Hi everyone, good evening. So welcome to our ZÉRA Talks February edition. My name is Kai and I'm your host for tonight. So as an introduction, ZÉRA is a platform, an online informative platform where you can find useful information ranging from pregnancy to postpartum. Okay, so we aim to provide support to all of you mothers out there, so especially during this pandemic situation. So therefore, we are happy to introduce our own community whereby we name it ZÉRA Mums. So feel free to use our hashtag ZÉRA Mums and share with us your journey as a mother, okay? So we will share your posts if we see any hashtags, all right? So tonight's webinar is brought to you by Haka Malaysia, who is best known for their silicone breast pump, and also Moss Japan, who has been a go-to brand for thermal-related products due to their elegant design. So as you all know, we are giving out RM350 worth of ZÉRA Care Box for 2 lucky winners, okay? So in order to be eligible, please remember to do the 3 following steps. So step 1, it will be like and follow ZÉRA, Haka Malaysia, and also Moss Japan's Facebook and also Instagram. So second, just fill up the Google form. And also third, just share this webinar out to all of your friends and family, all right? So make sure that your share post is also set to public so we can everyone can see it, okay? So just in case if any of you missed any of it, just head over to our description box in our Facebook live video. So we will pin all the details there for your convenience. So, and also just in case if any of you is streaming this via Instagram live, just head over to our Facebook instead in order to participate in our Q&A at the end of our session, okay? So the link can be found in our Instagram's bio. So just head to our Instagram and look at the bio there, okay? So also, just an added bonus. So Mums Munch, who specializes in milk booster cookies, is giving away a 20% discount exclusively to you, ZÉRA Mums. So simply just visit Mums Munch Instagram page at MOMSMUNCH and quote ZÉRAX Mums Munch to enjoy your 20% discount. Okay, so we will also pin all of this in the description box. So just to introduce the flow of the webinar, so we will be conducting this in 2 parts. So part 1 will be about pregnancy and part 2 will be about postpartum. So at the end of our webinar session, there will also be a Q&A session. So if you have any questions, just feel free to leave a comment in the comment box below, and then we will pick a few at the end of the session and answer them, okay? So without further ado, let's begin. All right, so allow me to introduce our first speaker of the night, Dr. Dahlia. She's an ONG consultant at Ohana Specialist Hospital, and Dr. Dahlia's main specialties will be high-risk pregnancy and also gynecological disorder. So tonight, Dr. Dahlia will be covering a topic on UPT positive, what's next? So let's welcome Dr. Dahlia. Yes, hi, Dr. Dahlia, you can start now.
All right, hi, Ki. Thank you for your kind introduction. I am honored to be presenting today. So I choose a very basic topic, and I promise it has nothing to do with medical. It's only one slide about medical, but I'll be talking more about the social impact on how to. It has nothing to do with the medical. All right, don't worry about that. Okay, let's just start. The topic today will be your UPT is positive. What are you going to do next? Okay, I'm sharing my slide. Your UPT is positive. What's next? Before that, sorry. Okay. I am Dr. Dahlia Abdul Malik. I am the ONG consultant, ONG specialist practicing in Ohana Specialist Hospital. Ohana Specialist Hospital is a new hospital in Wangsa Maju. The topic today is about your UPT is positive. What's next? What are you supposed to do next? It's just a light topic, very informal. If you have any question, just ask and we will try to answer at the end of this session. All right. Your pregnancy test may be positive, but do you have any positive feeling about this? You may miss your period and you had your urine pregnancy test and it come out as positive. At that point of time, you will be having all the negative or all the negative feelings. It's not nice to have this strange craving. It's not nice to have this nausea and vomiting. It's not nice to have this tiredness all the time, laziness and breast soreness. It's so tired to have all those symptoms. But don't worry about that. It is okay to have all the symptoms. As I said before, your test may be positive, but you may not be having a positive feeling about it. Don't worry about that. Everybody is facing the same thing. All right? First of all, this is the only thing that I'm going to talk about medical. Once your urine pregnancy test is positive, make an appointment for prenatal care. You're pregnant, congratulations. So find a healthcare provider. You can go to any government health clinic, any clinic kesihatan. You can go to general practitioner. You can visit our hospital. You can go to any hospital just to make sure that your urine pregnancy is positive. And just to have a further clarification about that. So what are you going to have upon this prenatal visit? First of all, the doctor will obviously ask you about the background history of your personal well-being. The doctor will be asking about the medical history, the social history, reproductive history, and also gynecological history. Most importantly is to provide the correct and significant history so that the healthcare provider will not be missing anything. And after the history taking, the doctor will be performing a few physical examination. The doctor will be examining your abdomen, doing the general examination, checking your blood pressure, checking your urine, checking your pulse rate, auscultating your heart, examining everything that may be significant to make sure that you are healthy to be pregnant. And the next thing will be an ultrasound. An ultrasound is very important to date the pregnancy. The doctor will be asking your last menstrual period. The last menstrual period will be the first day of your last period. The first day of your last period, remember? So if you are expecting a pregnancy, please make sure you jot down the date of your period. The most important day is the first day. From the first day, the doctor will be calculating when is your expected date of delivery. Most important about the ultrasound, once your urine pregnancy is positive, is obviously to determine where is the pregnancy. Whether you are having intrauterine pregnancy, which is, it's intrauterine pregnancy is good, it's safe. But If you're having extrauterine pregnancy, meaning the pregnancy is outside the uterus, this is not good. All right. Extrauterine pregnancy, also known as ectopic pregnancy. The doctor will be using this opportunity to do the ultrasound to see any other sonographic abnormalities such as your ovaries, your uterus, any presence of ovaries, any presence of uterine fibroid. All right. And at the end of your prenatal visit, we will be doing this serial of lab tests, which includes your blood group and rhesus, your hemoglobin level, and infectious disease screening. Usually, we will be doing this VDRL screening, hepatitis B screening, and also HIV. All right, so your urine pregnancy test is positive. You may not be having a positive feeling about it. Never mind, just take some time to adjust to this news. Once the reality sets in, it's time to take a deep breath, relax, and be gentle to yourself. All right, this is the best time to talk to your spouse. Share your feelings with your family members. You can also share your feelings with your doctors. And if you think if it is very overwhelming, you may consider a counseling for this to overcome these problems. Positive urine pregnancy test can be a surprise to anybody, and also can be a shock to anybody. You may plan for the pregnancy, you may not plan for the pregnancy. But you don't worry, once your urine pregnancy test is positive, just relax, take a deep breath, be kind to yourself, talk to your spouse, share your feelings, especially when you visit your doctor. All right, who needs to know that you are pregnant? Obviously, your immediate family members, your other children. Most importantly is your boss. Your boss may not. Your boss may need to adjust your working scope together with other co-workers. Don't forget to involve your boss, your other co-workers once your urine pregnancy test is positive. Don't worry, most of us will be very happy once you tell us that you are pregnant. All right? You don't worry about this urine pregnancy test. You don't worry about being pregnant. Nothing wrong being pregnant, but you just need to be kind to yourself. That's the most important thing. And share this good news. Talk to somebody. Now it's the time to focus on your health. Once your urine pregnancy test is positive, yes, you're pregnant. You are taking care of your unborn baby for 9 months. And afterwards, you are going to take care of your baby. So from now on, you need to think about yourself and also about your baby. Start taking all the vitamins. You need to take folic acid. You need to take vitamin D. You need to take calcium. All these vitamins is very, very important for you yourself and also for your baby. You need to do exercise regularly. By doing exercise, you tend to have a very positive feeling about this pregnancy. Eat plenty of fruits, vegetables, protein, and fiber. Remember, you are not eating for two, but you need to have adequate nutrients for you and your baby. Do not eat too much, but make sure you are eating healthy, balanced diet. When you're pregnant, you have a lot of hormones inside your body, especially progesterone, and you tend to have this constipation. And that's why you need a lot of fibers in your diet to ease your gastrointestinal movement. Stay hydrated, drink a lot of water, and avoid alcohol, avoid smoking, and avoid illegal drugs. These can affect your baby harmly. This may harm your baby from the first trimester, second trimester to the third trimester. Please avoid alcohol, smoking, and also illegal drugs. Remember, for those who likes to eat sushi, please avoid raw fish. All right? Avoid unpasteurized milk or dairy products and deli meats. And cat lovers, please, this is the time that you need to avoid cleaning your cat's litter box. Why? Because your cat may be a carrier of this nasty organism called as Toxoplasma gondii, and this Toxoplasma may harm you as well as your baby. Remember, the most important thing is be kind to yourself. Start to think about you and also your baby. Have a positive feeling about being pregnant. Focus on your health and do not skip your prenatal vitamins. Learn what to expect during pregnancy. You can read books. You can have online resources about pregnancy, being pregnant. You can read magazines and a lot of support group around here. For example, this ZÉRA Puspata, ZÉRA Moms. This support group usually support mothers to be or pregnant moms or moms in confinement to have a positive feeling about this pregnancy. Finding out you are pregnant, whether it is planned or not, it is a life-changing event. It is very important to be gentle with yourself. As what I explained to you, your positive urine pregnancy test can be a surprise, can be a shock to you. You may take it positively, you may take it negatively, but please, this is normal. It is normal to experience this wide range of emotion. With all the hormonal changes, you may be very angry, you may be very sensitive, you may be very clumsy at this point of time. Don't worry. You just be gentle with yourself. Sit back and relax and try to embrace that you're pregnant now. And this is no doubt is a life-changing event. I'm not saying that it is difficult, but you can do it. In those first few days and weeks after positive test, you obviously need some time to adjust to these physiological changes. Before your prenatal visit or probably during your antenatal visits, you can ask your healthcare provider. You can call your family members. You can reach out to your spouse. You can ask your close friends or those with experience. And probably you may celebrate this positive urine pregnancy test. Remember to give yourself time to enjoy this moment and you prepare for the 9 months and beyond. This is a very short presentation, and I don't want to talk a lot of medical jargons. This is just basically on what you need to expect, what you need to do once your urine pregnancy test is positive. I agree that once you look at the UPT, if you see the 2 lines, you may be surprised or you may be shocked. You may not be able to know what you're supposed to do next. You don't worry, just sit back and relax, be gentle to yourself, and you start to plan what you have to do for the next 9 months. Don't worry, your prenatal vitamins, stay hydrated. Pregnancy is not a disease. You may work as usual, you may do exercise as usual, but you just need to be gentle to yourself. Do not push yourself. Be kind to yourself. Any questions? You may ask your healthcare provider. Do not skip your antenatal care. I think that's all for now. And I pass to Key for next program.
Yes, hi. Okay, so thank you so much, Dr. Dalia, for your sharing. That was very insightful. Okay, so for those who just joined in, so welcome to ZÉRA Talks February edition. So don't forget that we are also having a ZÉRA Care Box giveaway worth RM350 to 2 lucky winners, all right? So all you need to do is the 3 simple steps. So step 1, just like and follow ZÉRA, Hakka Malaysia, and also Mosh Japan's Facebook and Instagram page, okay? So step 2, just fill up the Google form. And step 3, just share this webinar out to all your friends and family, all right? So just make sure your post is public also, so we can see it. So in case if any of you missed it, don't worry. Just go to our description box in our Facebook live video. So we will pin all of these details there. So, and also if you're streaming on Instagram page, just head over to our Facebook page instead in order to participate in our Q&A session. So the link can be found in our Instagram bio. So just go over there and click that, all right? So, and also as you all know, we are having a Q&A session later. So feel free to ask any questions. Don't be shy. Just comment in the comment section below. So we will compile all of them and then we will ask them at the end of the session, okay? So next up, okay. So next up, we will have Dr. Dini, who is an A&E doctor. So one interesting fact about Dr. Dini is that she has worked with Armed Force for almost 10 years, involving in preventive care, emergency medicine, pediatrics, and also ONG. So tonight, Dr. Dini will be covering a topic on tips and guides for happy confinement. So let us welcome Dr. Dini.
Okay, thank you, Miss Kai, for the great introduction. Okay, I appreciate the introduction. It's a great to be speaking with all of you today. I will be presenting the tips and guide for a happy confinement. Okay. Okay, today we talk about tips and guide for happy confinement. You already know that you have a good news to having a baby, so you should be happy mother. So this is tips and guide for you to keep happy and not stressed. So first of all, we need to know what is confinement is. The confinement refers to a recovery period after a woman gives birth. This is a process to return you to your pre-pregnancy physical and mental condition. So there is a duration for you to recover from your pregnancy state to your normal physical state. So for medically, we refer the confinement as a postpartum. It's up to 6 weeks duration. But we have a multiracial society, right? So for the Malays, it can be up 44 days to 100 days. Chinese, just a nice numbers, Chinese and Indian, which is they take the nice number 1 month duration. So after 1 month, you can be independent, back to normal, going back to the work usually. What to expect during your confinement period? Okay. By you know what to expect, so you can plan what you will going through. I divided this into 3 categories, which is what you can expect from the mother side, which is you, your baby, and your surrounding. Okay, For the mother, during the confinement, this is the time for your recovery period, which is your wound from any normal birth or your cesarean section will be healed during this time. And also your uterus your uterus contracted. This is the time for you feel some abdominal discomfort during this time. And at the same time, you feel your breast start engorged and producing more. And also, the last but not least, the hormonal changes. This make you emotional instability, more sensitive. This is the things that you have to take serious actually. Okay. And during the confinement, what will happen? You have a new baby. So with the new baby come to your world, come to your family, there is a commitment that you have to take care of, which is the baby need to breastfeeding, change the diapers, and sometimes a sporadic crying need to be attended for. So this quite challenge for the mother, which is for the first baby and not usually not okay. And the surrounding. If this is not your first child, you already have a 3 child before, so that's more challenge you have to encounter, which is you need to cleaning your house, you need to do the laundry, you need to do housework commitment and cooking for so on. When you expect this to be happen, usually this is the things that makes you become more depressed during the confinement. So now we go for the tips for happy confinement. By knowing what to expect, a simpler and easier lifestyle can be achieved. But you must mentally prepare and physically prepare for a child and potential event that can be occur. So plan your confinement prior. So how you can plan your confinement before you giving birth, before it happens. So you have to plan. If the help of other family members is necessary, plan ahead. So if your mother or your mother-in-law need to get involved, you can plan this, and you have to decide when will be the best time for them to get involved, how long the duration they will their help will be necessary. So if the third person cannot come to help you, so you can divide your task between your husband, sit together and discuss. For the person have financially more stable, so sometimes they can hire a confinement lady to help them for this time. So another point to the most important is explain to other children what the plan is, because when your other children understand what will happen, the new baby take place and the attention to the new baby more, so you help them understand the situation and reduce any form of potential tantrum due to their lack of attention during that time. And last but not least, set up your comfort zone, make your surrounding nice and comfortable. So when you feel the stress, you have some space, personal space to sit down and be relaxed. Okay. Any question you can type in the comments, so we go the question after this. So before giving birth, that's you plan for the surrounding. So after you plan all the surrounding, you plan for the baby that you will have after this. You need to breastfeed your baby. So the breastfeeding can be challenged for some people. What you have to prepare, attending the antenatal class or breastfeeding class. So read more from the internet, read more from the social media, read more from the magazine. When you know the technique, when you prepare for the challenge and difficulty, it's more easier for you to encounter this. And make sure availability of the equipment that can make your life easier, such as breastfeeding pillow, milk booster, and suitable chair with a good back support. I'm not suggest any breast pump yet during this time before giving birth, because the breast pump just have to take place after this, but because not everybody need it, so don't buy earlier, okay? So it's time. So that's the things yang you need to prepare before you deliver it. Now the time of delivery, what should do next? Okay, when you prepare all the things, you are more ready. Your mother-in-law or your mother take place in your house to take care of all your children, all everything. So you going to hospital and deliver the baby. So this is a happy moment, right? So you come back with a new person in your life, in your house, in your family. Okay. My tip is just go with the flow. Just go with the flow, go positive. To get a happiness, you should have enough rest, eat well, not to be in pain, comfortable surrounding, and good teamwork and supportive people around you. This is the tips for your happiness. So whatever happen, go to this concept. Enough rest, eat well, not in pain, and comfortable surrounding. How you go, settle all the things one by one. Okay? When the time has arrived, enjoy the process. But if necessary, have someone to vent to regarding your difficulties and experience. So if something happen, unexpected happen, you have someone to talk. Because we don't know what will happen next, right? You should sleep when the baby sleep. To get enough rest, you should sleep when the baby sleep. Because when the baby awake, you have to breastfeed them. Don't force yourself to do all the house chores. Take your time and only do when you are not in stressful state of mind or when you are well and more healthy. Concentrate only on you and yourself and your baby during the first week of confinement. The first week of confinement is a critical phase, which is you need to more concentrate to your baby and your healing process first. So no need to no need to worry about the house, the cooking, all the things you plan already before. And get the confinement massage. So eat healthy and easily cooked food. This will get you more organized and become more relaxed. Okay, I think that's all. Any question we can discuss in the answer and question before. Thanks all.
Okay, thank you so much, Dr. Dini. So we will move on to our Q&A session. So once again, don't forget to that we are having our ZÉRA Care Box giveaway worth RM350 to 2 lucky winners. So all you need to do is step 1, like and follow ZÉRA, Hakka Malaysia, and also Mosh Facebook and Instagram page. Okay. So step 2, just fill up the Google form. And then step 3, just share this webinar to all of your friends and family. Also, just to let you all know that Mom's Munch, who specializes in very yummy milk booster cookies, is giving away 20% discount to exclusively to all of the ZÉRA moms. Okay, so simply just visit Mom's Munch Instagram page at MOMSMUNCH and quote ZÉRAX Mom's Munch to enjoy your 20% discount. All right. So we will pin all of the details in our description box in our Facebook live video. All right, so we'll start with our Q&A session. Okay, so the first question that we have is, are we able to see baby's heartbeat after 7 weeks? How long does it take usually to see the baby's heartbeat? So Dr. Dalia, you can answer it.
All right. We can see the baby's heartbeat from abdominal scan, usually as early as 6 weeks. But if you are still unable to see from the abdominal scan, the doctor, the healthcare provider may be doing this what we call as transvaginal scan, by inserting a small probe through the vagina to measure the baby's length, the baby's measurement, and also to see the baby's heartbeat. If we are not seeing the baby's heartbeat beyond 7 or 8 weeks, a repeat scan may be needed, because we usually think that probably is a wrong date, or probably is a very early pregnancy. So the healthcare provider or the doctor will be repeating the scan to see the baby's heartbeat. I think if more than 2 scans, more than 1 week apart, if still no fetal heart rate, a diagnosis of miscarriage may be confirmed.
Okay, thank you so much, Doctor. So our next question would be, since now is MCO and we can't attend any antenatal classes, can you share what should we read or learn for smooth delivery, or any book or YouTube videos that you would recommend?
Right, about antenatal classes, I'm sure a lot of online antenatal classes is being conducted in Facebook, in Instagram Live, and YouTube. I don't specifically has a very specific book that you may need to refer to. You may search in your online resources or in any books. But I personally really like to read about anything about. I really like to read the pregnancy books, especially the modern and a simple pregnancy book. I don't usually like the thick, complicated book. I don't have a specific suggestion which book that you may refer, but nowadays, because of this MCO, because of this pandemic, I see that a lot of pregnant mothers get the good support from support group from online, or probably in certain hospital will be doing online antenatal classes.
All right. Okay, so I hope that answers your question. So the next one, we have a question saying that I'm a beta thalassemia, HB 10 to 11. Do I really need to increase my vitamins intake from daily dose to twice a day?
All right. In a pregnancy, the ideal hemoglobin will be more than 11 grams per deciliter. If you are beta thalassemia, you may be okay with hemoglobin more than 9, or probably, and usually for thalassemia patients, they are usually doing okay with hemoglobin less than 11. We know that thalassemia do not usually respond to ferrous fumarate or iron supplement. So if you take extra also, it may not be beneficial for you. In Malaysia, most of thalassemia patients usually has simultaneous iron deficiency anemia. What I'm suggesting is that you check your hemoglobin very frequently. Probably in the list is that every month you check your hemoglobin level. You target your hemoglobin more than 10 gram per deciliter. If you cannot target 11 gram per deciliter, if you can achieve more than 11, that's good enough. And if you are taking your iron supplements, you may take daily dosage. Don't forget your iron-rich diet.
All right. So next question. Is it advisable to take additional supplements not provided by the KK? For example, hematicins, vitamin C, like calcium and omega, etc.
Hematinics, you mean hematinics?
Yes, the question is hematinics, vitamin C.
All right. Hematinics is actually the supplement to increase your hemoglobin level. You need ideal hemoglobin level for you yourself and also for your baby. Adequate hemoglobin is vital to transport nutrients and also oxygen to you and to your baby. So hematinics is good to have. And I would say that pregnant mom needs to take hematinics. Vitamin C is actually to increase the absorption of hematinics. If you take hematinics with vitamin C, there will be better absorption. And calcium and also vitamin D is also important for your baby. Calcium especially is good for the mother and also for the baby. And about the vitamin E and other supplements, it's nice to take it. You may take it, you may not take it. If you feel like, okay, you're pregnant, you have a lot of vitamins to take, you just concentrate on hematinics, vitamin C, calcium, and vitamin D.
Okay, so the next one would be regarding folic acid. How long do we need to take and at which trimester do we need to stop?
Right. Folic acid is actually very important at least 3 months pre-conception. 3 months pre-conception means 3 months prior being pregnant. So a woman planning for a pregnancy needs to start taking folic acid. Why? Folic acid is very important in the development or in the formation of central nervous system of your fetus. Okay, once your urine pregnancy test is positive, it means that your baby is already there. The central nervous system already developed. So you may need to take folic acid prior to being pregnant, while being pregnant, and also you need to continue while after the delivery during the breastfeeding. Folic acid is very important, especially for the development of for the growth of individual cells. For pregnant women, folic acid is very important for the baby, especially prior being pregnant, pre-conception period.
Okay, so our next question would be, what happens if my milk production is reducing?
What happened is what? Sorry, I can't hear you.
What happens if my milk production is reducing?
What happens if your milk production is reducing after the delivery? All right, the very basic thing about milk production, about breastfeeding is one, be gentle to yourself, do not stress yourself. And the production of milk will be is usually adequate for your baby, because the baby stomach is just as small as a bib. They say that it's very small. So if your baby is taking about if your baby is breastfeeding, okay, sometimes you may feel that your breast milk is not adequate for your baby, but after breastfeeding, your baby goes into sleep, it is considered as adequate. But anyway, if you feel like your breast milk is not adequate, you may take, first of all, don't be stressed. All right, the more regular you try to breastfeed your baby, the more will be the hormones in your body to stimulate the milk production and milk ejection. And you may consider taking nutritional supplements to increase your milk production.
Okay, so next question. I'm really interested to know about confinement massage. What is the medical opinion about this?
All right, I think this question is for Dr. Dini, but all right, she wants me to answer anyway. All right, postnatal massage is very is actually is good. It's good for pregnant.
Hold on, yeah, we are having some technical difficulties. We will reconnect Dr. Dalia again. So for the meantime, just don't forget to join our ZÉRA Care Box giveaway. So the 3 simple steps, so just like and follow ZÉRA, Hakka Malaysia, and also Moss Japan to stand a chance to win our RM350 worth of ZÉRA Care Box, okay? So there will be 2 lucky winners selected at random. So other than that, also just remember we have also giving away 20% discount exclusively for all our viewers today. So that's given by Mom's Munch. So they supply milk booster cookies. So it's very yummy. So just make sure, you know, to also go ahead on her Instagram account at Mom's Munch to check that out. So the special code will be ZÉRAX Mom's Munch, okay? So don't forget, and if you have any more questions, just feel free to comment. All right, so we will try our best to respond to all of them, but we are actually receiving a lot of questions. So we will select, you know, the few ones that are more technical for the doctor to go ahead with it. Okay, so just give us a minute. We will try to reconnect Dr. Dalia in. So, you know, for all of you who is unsure about what ZÉRA is, so basically ZÉRA is an online informative platform for all pregnant women, or, you know, mothers who are already in motherhood. So our main aim is to provide like virtual support to all of the mothers out there. So be it whether you're just pregnant or you're getting pregnant, or, you know, you're already in your 2nd child, 3rd child, or 4th child, you know, this is a very safe space for you to just share your thoughts with us, you know, just try to interact, engage with us, let us know your experience. So we are also trying to post a lot of different informative posts. So for example, the few ones that we did was on weight loss after childbirth, trimester, 1st trimester, 2nd trimester. The 3rd one will be coming, so keep a lookout on that. And so we've been doing, you know, like how to juggle your life after pregnancy, going back to work. So sure that a lot of you here are working mothers, and of course it won't be difficult, but, you know, just remember to take it easy, try to ease back on the routine. Okay, so we have Dr. Dalia back now. Okay, so doctor, so I'll just read out the next question that we have.
Hi. Sorry,
Yeah, I think
something wrong with another laptop.
it's okay. Yeah.
Okay, so back to the last question. You were asking about the postnatal massage.
Yes.
The postnatal massage is really good. Okay, you may start any mom post delivery may start having the postnatal massage as soon as possible. But there must be people will ask whether normal delivery or cesarean section should have the same postnatal massage or how. But in my opinion, both normal delivery or cesarean section may benefit from this postnatal massage. except that we just need to tell the post cesarean section moms to avoid massaging the abdominal part, the area, the abdominal part. That's all. But otherwise, postnatal massage is really good. It actually can boost your milk production, can release stress, can reduce water retention, and it's really good to have this postnatal massage. It gives some kind of relaxation.
All right, thank you. So our next question would be, can pregnancy with heart disease give birth normally or just cesarean?
All right. For heart disease, we have few classification. We are following this New York Heart Association classification. It can be NIHA 1, NIHA 2, NIHA 3, NIHA 4. It actually depends on types and structural abnormalities of individual heart disease. And during antenatal checkup, the healthcare provider or the doctor will be assessing the capability of a woman with heart disease to get pregnant, to be pregnant, and also the mode of delivery. It actually depends on the type of the heart disease. Certain heart disease may require cesarean section, definitely. Certain heart disease may allow some short trial of labor, meaning that we only allow few hours of try to deliver normally. And just to let you know that a few types of heart disease, if the woman has that kind of heart disease, she may not be allowed to be pregnant.
Okay, so another one. So I have a question about morning sickness. I used to join an antenatal webinar before, and the doctor who delivered the explanation tells us morning sickness is a sign that the pregnancy is progressing. It's a good sign for those who had morning sickness. So what about those moms who doesn't get morning sickness during pregnancy?
All right. Every pregnancy is very individualistic. Morning sickness usually reflects the level of HCG, or we call it as human chorionic gonadotropin level in a pregnant moms. Some tolerates well with high level of this HCG. Some do not tolerate well with this high level of HCG. It is quite common to see morning sickness, and it's actually a common sign of pregnancy. If you're not having any morning sickness, you don't worry, as long as your pregnancy is developing. You talk to your healthcare provider, and the doctor will be doing a scan to see the growth of the baby. You don't worry. But most of the time, the morning sickness happen in most of the pregnant mom, and it may goes up to 16 weeks. Some of the morning sickness is associated with other disease, for example, hyperthyroidism or any kind of infection. Morning sickness is, if you're having morning sickness, if you feel very, very tired, if you feel that you can't really take orally well, you need some hydration, you need some support, I usually advise my patients to come to hospital to get hydrated. Once she's okay, then she can be discharged. But this cycle will be repeated. She will continue to have this morning sickness up till 16 weeks. Don't worry, just come to hospital. If those who are not having this morning sickness, don't worry also, as long as your pregnancy is developing well.
Okay, so next question. If there is a cyst located near the womb, can it endanger the fetus?
Right. The cyst, Cyst usually refers to an ovarian cyst. Ovarian cyst is not inside the womb, it's actually outside the womb. We know that during pregnancy, I also mentioned earlier that during the prenatal checkup, the doctor will be using this opportunity to do scan to look for any abnormality in ovaries, for example. Sometimes cyst can be a good cyst. We call it as corpus luteal cyst or physiological cyst. This cyst can be found in early pregnancy, less than 12 weeks, and this cyst actually provides support, progestogen support to the baby, to the fetus. Generally, any persistence of cysts beyond 12 weeks, the healthcare provider or the doctor will be assessing whether this is something non-physiological. So the doctor will decide whether removal of the cyst need to be done, or the cyst is just for monitoring. Generally, the presence of cyst in a pregnant woman do not usually directly affect the baby. It's just that the presence of cyst in a pregnant woman that may actually put the doctor in a dilemma is that the cyst may be ruptured, the cyst may be twisted, and the cyst may be infected. The presence of these complications may endanger the maternal health, not directly to the baby. Most of the cysts found before 12 weeks is usually physiological. It's normal to see this kind of cyst.
Okay, so next question. So what to expect or do when doctors say your baby breech? I am now 28 weeks.
All right. Breech means the baby's head is up there, not down, carefully. All right. 28 weeks, baby is still small. Inside the uterus, the baby can move around. Don't worry if the baby is breech, but most importantly is to see the localization of the placenta. It is quite common to see the placenta covering, the placenta located at the lower part of the uterus at 28 weeks. If your baby is in breech position at 28 weeks, usually it's okay. The doctor will decide, will localize the placenta, and next appointment with your doctor, she will be assessing the location of the placenta, and also she will be looking at the position of the baby. The baby's position at 28 weeks usually it can be transverse, it can be breech, it can be Catholic, because baby is freely swimming inside your tummy. So don't worry, at 28 weeks, if your baby is breech, your doctor will be assessing. What you need to worry is that if your baby remains in breech position after 36 weeks.
Okay, so we have our final question. So will the size of your tummy influence the baby health and development?
The size of the tummy will be
the size of the tummy influence the baby health and development.
All right. Is actually basic things that we doctors do during antenatal checkup. We usually measure the fundal height. All right. From the fundal height measurement, we can actually determine whether this is what we call as uterus smaller than it, or uterus larger than it, or uterus is equivalent to it. The size of the tummy usually reflecting the baby's size, whether it's smaller or bigger, whether the baby has, whether there are excessive amniotic fluid or inadequate amniotic fluid, or very rarely, if the size of the tummy is very big, we may suspect, if everything is okay, if baby is okay, the amniotic fluid is okay, we may find what we call as pelvic organ tumor, but we don't usually see this. And to answer to that question, yes, the size of the tummy is an indicator. Is one of the indicator to determine the baby's well-being.
Okay, so that comes to our end of our ZÉRA Talks February edition day 1. So we would like to thank Dr. Dahlia and Dr. Dini for their sharing. So we hope that this session has helped you gain some valuable insights, on pregnancy and postpartum, so which you are able to bring along with you on your motherhood journey. Okay, so we'll be having another session tomorrow at 8 p.m. And we are honored to have Dr. Mai from Prince Court Medical Center and also Dr. Eliza from Kulimba Asia Hospital, who will be sharing separately on antenatal care and what they don't tell you in the postpartum period. Okay, so see you tomorrow, and don't forget to do the 3 simple steps pinned in the description box of our Facebook live video, and then stand a chance to win a 350 ringgit worth of ZÉRA Care Box. All right, so thank you and take care, everyone.